Okay, hello everybody. Welcome back to TWIG. TWIG stands for This Week in Global Health. This is your one-stop shop for all the good, the bad, and the ugly in this global health space. This is a live show. So you might be watching this at some point in the future on YouTube, in which case, obviously, it's not live. But if you're watching this live right now, you can send us questions and comments via Twitter. If you use the hashtag TWIGH, we will get those questions, and at the end of the show, we're going to respond to those and answer them and have a little bit of discussion. In the meantime, let me tell you about this week. We're going to be talking about health systems. Okay, this is the week that there's a health systems conference down in Cape Town, so we try to get our episodes to coincide with events that are happening in the global health space. We're talking about health systems. Before we carry on, I'm going to ask the members of the team just to quickly introduce themselves. I'll start with myself. My name's Greg Martin. I'm here in Dublin. Next up, Katie. Katie, talk to us. Who are you, where are you, and what are you going to talk about today?
My name is Katie Jackson. I'm coming to you from Stockholm, Sweden. Today I'm going to touch upon health information systems and then talk to you about some requests for proposals that we have.
Okay, thanks very much. Next up, Christy, who are you and what are you going to talk to us about today?
I am Chris Ronson. I'm broadcasting from San Francisco, California, and I'll be talking to you today about health system service delivery as well as an upcoming conference of interest to many people out there in global health.
Thanks, Christy. And Jessica, what are you going to talk to us and where are you today?
Hey everyone, I'm Jessica Taff. I'm coming to you from the DC metro area. And today I'm going to tell you a little bit about the human resources that are needed for strong health systems and also how you go and finance these systems.
And last but not least, Vanya. Vanya, talk to us.
Hi everyone, I'm coming to you from London, UK, and today I'm going to be talking a little bit about two updates on the Ebola outbreak, as well as two components of health systems, those being medical products and technologies, and leadership and governance.
Okay, and before we carry on, here's a quick advert. Good news, we now have a web page. So on your screen at the moment is the URL for the web page. It's twigh.org. If you're watching this on YouTube in the future, I'm going to make that a clickable link, so you can actually click on the screen on that link. It'll take you there. Associated with that webpage, you can now contact us at hello@twig.org. And of course, as always, we would love it if you would support us at patreon.com. I'm going to ask Jessica just to talk to us quickly about what we're going to be talking about next week, and then we'll jump right into today's show.
Absolutely. Okay, so next week we're going to touch on working in global health. So if you're interested in working in global health, this is definitely the episode for you. We're going to talk about the kind of organizations that you can work for when you're a professional in global health, the different roles and the different associated skills that you would need to have in this field. And we're going to highlight some great web pages and resources that can help you look for jobs or just learn more about what it's like to work in global health. And we're also going to tell you a little bit about the various career paths of global health professionals and maybe even tell you a little bit of our own career paths and how we got involved in this. So again, if you're interested in global health and working in it, or even if you're just transitioning it from a different job into global health, this is the episode for you to watch.
Okay, so tune in next week about finding work in the global health space. Very exciting. So this week we're going to be talking about health systems, and the panel members are going to go into a little bit of detail in each of the building blocks, but I'm going to give you like the 30-second overview. What are health systems? Well, there's what we call kind of 6 building blocks, and I'm going to walk you through the sort of sense of it. The starting point is if you've got a sick person in the country, what do you need? The person needs medicines. Let's start with that. They need products that are going to treat them and help with diagnostics, etc., etc. So medical products, getting the right things and technologies into the country. That's health system building block number 1. That medicine needs to be given to the patient by somebody, right? Or the diagnostics need to be operated by somebody. So human resources for health, building block number 2. Those medicines need to be given to people by somebody in the context of a clinic or a hospital or some sort of health service delivery system. So building block number 3, service delivery. Number 4 is technology, like IT, right? And that's because what we want to do is we want to manage all of this. We want to have information about what's happening. Are there stockouts? Are the drugs coming in, etc., etc.? What are the statistics around improvements or deterioration in health outcomes? So there's IT, right? That's number, what was that, number 4? That's number 4. Okay, number 5 is these things have to be financed. Everything must be paid for. So the 5th thing is health financing, and number 6 is, of course, governance and leadership, right? You need someone at the top of the food chain saying, look, this is how it's all going to happen, and coordinating with other departments in the government, etc., etc. So those are the 6 building blocks of health systems, and we're going to go into each of those in a little bit more detail in this show. Actually, we're going to start off with Vanya. Vanya is going to talk to us about medical products and technology for health. Okay, over to you, Vanya.
So that's right. Medical products and technologies represent the second largest component of health expenditure in low and middle income countries. And that's after salaries, of course. And for this component to be in shape, there must be a regulatory system that ensures high quality and safe products are available, a national list of essential medicines per level of care, treatment protocols, and procurement guides, a supply and distribution systems to ensure universal access everywhere. So not only in urban areas, but also in rural areas, for example. And there also needs to be a national price monitoring system and a national program to promote rational prescribing. I'm just going to give some quick facts as to why this component is so important. So it has been estimated that the presence of counterfeit drugs is about 1% of medicine sales in developed countries to over 10% in developing countries. And in some African countries, it's as high as 30%. So you can see that that is a big issue. And also the total number of people without access to essential medicines is 2.1 billion people in the world, and in some countries like Ghana, 62% of the rural population have to travel more than 30 minutes to a health facility, which goes back to the distribution system in health systems.
Wow. Okay, I didn't know those factoids. That's really interesting. Thanks very much, Vanya. And just so that people know, like when we talk about getting products to people, there's a whole lot of little bits and pieces and steps that need to be in place. We won't go into that in detail, but just briefly, it's, you know, if you want to get like drugs into the clinic, what do you need to do? You need to start off with demand forecasting. How much do we need? Then you need a tendering process, which so the government say to the drug companies, okay, like this is what we're prepared to pay for these drugs. Then there has to be a procurement, shipping, warehousing, distribution, all of these, and then these things get to the clinic. There has to be inventory management, and then the rational use of these products. So within the point that I'm making is that within any of these building blocks, there are multiple other little stepping stones and bits and pieces that you need to know about. We won't go into all of those in this particular show. In fact, what we might do, we might have a show that is specifically dedicated to the procurement, supply chain management of products, for example, and we'll do that at a later stage. All right, for today, carrying on, Jessica, talk to us about human resources for health.
Right. Okay, so in order to have a strong and well-functioning health system, you have to have the human resources to be able to run it. Now, this includes doctors and nurses, pharmacists, and also other healthcare workers that will run the system for you. Now, in order for this to happen, there's a bunch of things that need to happen. Okay, you've got to recruit these individuals for these specific roles. You need to educate them. So this includes having medical schools for doctors. And then you need to train them, for instance, training of nurses and community healthcare workers. And very importantly, you need to retain them in the workforce. Now, there are definitely issues with brain drain in developing countries. This is where you have doctors that are trained abroad and then often don't return to their own countries. Now, these issues aren't really a problem in the developed world, but they are in other parts of the world. Now, globally, you have rural areas that are served by only 38% of the total nursing workforce. And in other areas, the same like the rural areas, you have them served by less than 25% of the physician workforce. And another interesting fact is that less than 2% of the global health expenditure is spent each year on health professional education. And 57 countries in the world have a health workforce crisis.
Okay, very interesting. Jessica, I wonder if you could quickly just talk us through, just to keep things topical, we're in the middle of seeing an Ebola crisis unfolding in front of us. And, obviously you can't look at the Ebola crisis without thinking, well, this is really about health systems and weak health systems. Can you just talk to us a little bit about how some of what you've just said in the context of human resources, etc., relates to what we're seeing unfolding in the Ebola crisis?
Absolutely, and this is a great time to mention it because, yeah, there's been a lot of discussion of how weak health systems are involved in this Ebola crisis, and it's lack of human resources that have been noted as a reason why Ebola is ravaging both Liberia and Sierra Leone. Now, for instance, Liberia has 51 doctors for their 4.2 million people, and Sierra Leone has 136 doctors for their 6 million people. Now, if you average that, that's 1.1 to 0.2 doctors per 10,000 people, which is just crazy. Can you imagine being not having those doctors? Now, on the other hand, other countries that have had Ebola in their borders, like Nigeria and Guinea, they have stronger health systems and they have more human resources. And this has been noted as a reason why they're able to contain the epidemic more than the other two countries. Now, more information on this can be found in our show notes. There's a great article in the BBC that talked a lot about this.
Okay, and just to reiterate that, all the links to the URLs and the web pages, etc., that we make reference to in the show will be in the show notes. If you want to get those show notes emailed to you, you can sign up to a weekly newsletter. If you just go to the description below this video on YouTube, you'll see a link. It'll take you to a form, fill it in, push submit, and voila, you're going to get the show notes. All right, moving right along.
Greg,
yes.
I just want to mention, since we just are talking about Ebola, it might be worth mentioning the kind of updates that are going on right now with that. I think Vanya was...
Vanya, talk to us about... let's just have a quick interruption on the health systems talk, because if we are nothing if not flexible, and we'll jump right in with a quick update from Vanya on the Ebola crisis. There's been some breaking news. Vanya, over to you.
And that's right. So the first case of Ebola has been diagnosed outside of Africa. This happened in the U.S. today, specifically in Dallas, Texas. So that's the first piece of news that I wanted to share with you. And the second one is that today the World Health Organization has concluded a 2-day meeting to discuss one radical idea, so that of bringing vaccines into the field without having tested its effectiveness. And I think the results from this meeting were meant to be coming out today. So keep up on the WHO website to see if what the solution was or what.
Okay, so we haven't seen those results yet, but if they come out, we'll stick a link to those results in the show notes so that you can read about them, etc., etc. But they're not out at the moment. They're supposed to come out today sometime. So we've talked about products, we've talked about human resources. Next up, we're going to talk about service delivery. Christy, over to you.
Hi. Okay, so just to follow up with what Jessica said, listing some of the characteristics of a well-functioning health system, the next component is going to be a network of service and delivery that includes a number of different characteristics. This is inclusive of comprehensiveness, accessibility to care, continuity of care is going to be incredibly important, as well as a people-centered approach, coordination, and accountability and efficiency of the professionals in the workforce. All of these criteria are actually contingent on a number of other things, including a network of primary care services with backup in specialized hospital services. We've got standardized norms and guidance to ensure access to care for all people, as well as mechanisms that hold providers accountable for patient access to care and quality, and probably most importantly, to ensure consumers are represented and that they have a voice in their type of care.
Right, brilliant. Thanks very much, Christy. Okay, Katie, over to you. We want to hear all about health information systems. Talk to us.
Well, health information systems is basically all the data that you would have, and it's really kind of everything involved in it. For me, I always think about good data, you have good services, bad data, you don't have good services.
That's a great summary.
But I'll go further into it.
This item is now done.
I'll go further into it a little bit. Health information system provides the underpinnings for decision making and has 4 key functions. It generates data, it compiles the data, it analyzes and synthesizes the data, and then it's available for communication and use. So that's basically health information systems. Right now, the biggest focus for health information systems that I have come across is making electronic medical records. So making the medical records not handwritten, not paper, but available in an electronic form, meaning that they can be passed around the world through internet and be a more synthesized system.
Okay, very interesting. So we've talked about the fact that you need products. You need people there to give the products or the medicines to the patients. You need to have this happening in the context of a service delivery system, so clinics and hospitals, et cetera, and of course you need some sort of health information system to kind of let us know what's going on. Next, of course, all of this needs to be financed. Right, who's going to talk to us about finance? Jessica, talk to us about the money.
All right, so this is a really important topic because money just does not appear out of thin air to support health systems. These systems have to be financed and managed properly. So specifically, health systems need ways to raise sufficient funds for health fairly. They also need a system to pool financial resources across the population to share the financial risks. And you also need financial governance systems that are supported by relevant legislation, financial audit and public expenditure reviews, and clear operational rules to show how these systems are going to work and ensure the efficient use of these funds. Now, some interesting facts about this. 150 million people each year suffer financial hardship due to paying out of pocket for their own healthcare costs. And 100 million people each year are pushed into poverty as a result of this. Now, if you've heard of universal health coverage, which I'm sure a lot of you have, this is one of the main goals of it. It's to eliminate the financial hardships that are associated with healthcare in the world. Now, we're not going to talk about that a lot today, but we will cover it way more in depth in a later episode.
Yeah, we'll do a whole episode on that. That's really worth focusing on. Absolutely. Yeah.
Also, before we move on, I just wanted to give a quick note on the increased use of health technology assessment systems to assess the cost effectiveness of different drugs and technologies in health systems. So basically what health technology assessment systems do is evaluate the properties and effects of different medicines, as well as their cost in order to determine whether they should be available and publicly financed by the health system. And I just wanted to briefly mention that this will happen in developed countries. So we can see examples in Thailand and Taiwan, middle-income countries that have increasingly used this type of system. I think this is worth mentioning today's episode.
Thanks, Vanya. Unfortunately, your sound went a little bit haywire. We could hear you, but you sounded like sort of a character from a sci-fi movie.
I'm sorry about that.
In actual fact, now, Vanya, we're going back, and on the poverty thing, just that statistic that you mentioned about the number of people that I seem to remember reading somewhere that there are some countries, and I can't remember which ones, in which the number one reason for being pushed into abject poverty is unforeseen health expenditure. So universal health coverage, very important. We're going to cover that in detail. We're actually going back to Vanya, and I'm hoping that you're not going to be from a sci-fi movie now. Let's see, to talk about leadership and governance.
Well, I hope it sounds so good. So yeah, leadership and governance, I consider probably the most important component of the health system because governance is in charge of creating the other 5 components of the health system. Is this sound okay, or am I still?
It's not great.
I don't know what's happening.
Worry, just carry on. We'll get most of what you're saying.
Okay. So basically, government ill. Health governance must ensure that health authorities for the entire health sector in a coherent manner. So not only the public sector delivery, but also so the private sector, NGOs working for health, etc. And related to this is the role that health governance plays in ensuring policy coherence among different government departments that impact health. So for instance, those in charge of water and sanitation, education, etc. And another thing that health governance and leadership does is defining national health policies, strategies, and plans, and overseeing resource allocation for healthcare. Okay,
thanks, Vanya. So if anybody ever doubted that this show goes out live, well, now got evidence. This is not pre-recorded footage. Thanks very much. Look, what we're going to do is if you didn't get all of that, then subscribe to our newsletter, and we're going to have all of those details in the show notes, and you can read all about it. But essentially, like the summary of what Vanya was saying is leadership, governance, very important. That's
or maybe that's a way of like a teaser where like we're gonna just feed it in a little bit, and that's why we're gonna get you to subscribe to our show notes. So that's where you get the full information.
We did this on purpose. Actually, it was all.
Yeah, we're a bit sneaky like that.
I would actually say that it's probably worth us doing, as we've been saying all along here, it's probably worth us doing an entire episode that just focuses on health governance and leadership. There's no question we're going to do an episode on that. Okay, so stay tuned. Watch the space. We're going to do more on that, and we're going to bring Vanya in to talk about it. Now, and more evidence that this is a live show is we've got Tim. Tim popped in there, and Tim is actually in Cape Town at the moment at the Health Systems Conference. Tim, I don't know if you've got anyone else with you in the room. We're talking about getting a guest in, or if can you tell us what's the lowdown? What's the word on the street?
Sure. Yeah. Sorry to suddenly join you. We just got back from the conference. We're at the Global Symposium on Health Systems Research in Cape Town. I just want to highlight a couple of things, and I'm going to introduce you to one of the participants here just for a minute. There are a couple of things I want to mention. You've just been going through the health systems building blocks, and one of the things that's being discussed here in Cape Town this week is the need to update those, particularly to include communication, which is one element that was missing from the previous draft, but also community and patient engagement. And the other thing that's been talked about a lot here, which people might not be that familiar with, is implementation research. And this is research that looks at the factors within the context within a health system that makes an intervention which maybe works in one setting less effective in another. So when you're scaling things up, what are the factors that influence local effectiveness? And they're two of the real priorities that have come up. And actually there's a new consortium with 4 organizations that are issuing a statement here on the importance of implementation research, including the World Bank and WHO. And we'll get that out to you. Actually, they're looking for signatories to that statement, which we're going to put online, and we'll give you a link to that tomorrow.
Okay, brilliant. So we'll get a link to that in the show notes. Thanks. Yeah,
sure,
yeah, carry on.
Sure. I'm just going to ask someone to join here, Mariam Bakker, who's from Global Health Middle East, who's one of the participants here. Just to, I don't know, to say something about the conference or to say something about health systems in the Middle East. Just 1 second while we swap places.
Okay, brilliant. Thanks very much. So
while they swap systems, I just want to say I love implementation science. This is fantastic. And okay, I should put a disclaimer out that I do consult for the World Bank, and they're all about this and the science of delivery. But it's just a great way, and they're not the only ones doing it. NIH is definitely focused on implementation science, and it's yay implementation science. So that's all.
You didn't do an applause. You know, we've got to get the applause going. Okay, so okay, back to our special guest. And sorry, I've never met you. This is the first time, and I actually don't know your name. I wonder if you could introduce yourself and tell us a little bit about what's happening in Cape Town.
Yeah, so can you hear me, number one?
Yes, yes, we can.
Yes, okay, great. So I'm Mariam Bakker. I work with Tim at Inish Communication, but I also lead Global Health Middle East, which is an online platform that informs and advocates on health systems reform in the Middle East. And I'll go back to that, but let's report from the symposium first of all. So it's been great hearing your discussion tonight because you've really touched on all of the main themes that have come up at the symposium so far. There's been a real focus on health workers and supporting community health workers and health workers, especially in response to the Ebola crisis. And there's a special session today on the Ebola crisis because it was the whole symposium was geared towards the theme of people-centered health systems, and then suddenly, and since August, and since at least the rest of the world has mobilized on Ebola and attention has spotlighted on it, you can't really have all these academics sat in a place and not talking about the main health systems thing going on in the world. So Tim Evans said today at the symposium, it's not just a failure of a national health system in the countries that have been affected, but it's a failure of the international health system.
Yeah,
and the World Bank now is,
yeah.
And that the World Bank now is working. I mean, it's for the next crisis, the next outbreak. It's not timely for now, but on an instrument that would allow for the resources to be available to be mobilized, because what's really happened here is a delay in mobilization and resources and health workers. So I would say that's the main message that's come out of the conference for me.
Right.
And I also just wanted for the audience to situate, health systems can be quite technical. There's a lot of jargon, there's a lot of definitions. But I wanted to relate the health systems back to global health in a more concrete way from my own experiences, which working for Global Health Middle East, which is, the way your health system is angled is extremely important. In the Middle East, we have the highest non-communicable disease burden for diabetes, obesity, and mental health. And we have health systems that have extremely emphasized curative health services. And we really need reform towards preventive and a really public health perspective to be able to deal with these global health challenges.
Okay, super duper. That's been really good having you on the show. And don't go away, because in a few minutes we're going to be fielding questions from the audience. This is a live show, so people will be tweeting in questions, and there may be questions that are directed at you. So if unless you're in a hurry to be somewhere, I don't know what you're doing.
No, we're around. We're hanging out.
Okay, brilliant. So we can throw questions at you. Fantastic. So we've dealt with all the health systems. We've had a special guest appearance from Cape Town. Excuse me. I'm going to ask Katie just to talk a little bit about a request for proposals that's out there at the moment.
Well, this is a super interesting show so far, so let's keep it going. I'm not actually going to do a specific request for proposal. I'm going to highlight an organization that usually has rolling requests for proposals, which is very difficult to say. The organization is called the Alliance for Health Policy and Systems Research. And the Alliance's overall goal has remained unchanged since its inception in 1999, and it promotes the generation and use of health policy and systems research as a means to improve health and health systems in developing countries. They pursue this goal by harnessing existing methods, approaches to improve both the quality of research and its ultimate uptake. So some of the recent RFPs are a call for technical support centers on non-state providers, case study teaching materials demonstrating the use of systems thinking tools and approaches, and manuscripts for peer-reviewed publications on the factors contributing to or lack thereof achieving MDGs 4 and 5. I forgot to mention also the Alliance, the WHO institution. So if just keep your eye out for that. We'll add it to the show notes, of course, their website, and there is always requests for proposals that are ongoing.
Okay, super duper. So there'll be links in the show notes to those requests for proposals. Subscribe to our newsletter. You'll get those. Next up, and this is going to be our last item for tonight, we're going to ask Christy to talk to us about a conference that's, I think, starting tomorrow. Christy.
It is. The UCSF Science of Global Health What's Next conference is going to be starting tomorrow at 8:30 a.m. I will actually be there on the ground, so it should be really interesting. It is sort of to recognize the 10-year anniversary of that program at UCSF, and it's bringing together a number of global health professionals from all over the world. We've got the NIH, we've got the Minister of Health from Rwanda, just people at the top of their field. It's going to be reviewing a number of different things from preterm birth, neglected tropical diseases, global surgery, funding for global health, emerging threats, measurement and evaluation techniques, pretty much running the gamut, but there's going to be an exceptionally relevant panel on the age of pandemics and the need for global collective action, which I'm confident will be covering Ebola. So that is tomorrow from 8:30 to 5 at San Francisco. They actually are sold out, but they will be doing a live cast. All of the links to the website where they'll be doing the live cast and to more information on the UCSF Global or Science of Global Health Conference will be available in our show notes.
In the show notes, brilliant. Okay, so now if you're watching this on YouTube, the show is about to end. So let me just quickly tell you, you can go to twig.org and see past episodes. You can also, incidentally, in future, and even tonight perhaps, I don't know if anybody is, but you can watch this show at the twig.org webpage. So until now, you've had to go to a new event page every time we've done this. Now there's one place you can go, same place, same time, every week, and watch the live show. You can contact us at hello@twig.org. Please support us at patreon.com. So for those of you watching on YouTube, this is goodbye. For those of you that are watching this live, don't go away. We're going to have questions and answers and a little bit of discussion now. So this is goodbye. Don't ever change. Don't do drugs. Always do your best. To some of you, always use a condom. And cheers. All right. So that's the end.
Quite the sign off today, Greg. Quite the sign off.
Yeah.
That is the end of that's the end of the YouTube show, and we're going to go for questions and answers now.
Well, it'll be the perfect segue for our HIV episode that we do.
I was going to say.
So.